From Penn State Health, Milton S. Hershey Medical Center, this is Ask Us Anything About Eating Disorders. I'm Scott Gilbert. This is National Eating Disorders Awareness Week, and the theme this year is It's Time to Talk About It. Here to talk about this important issue with us is Dr. Rollyn Ornstein. She is Division Chief of Adolescent Medicine and Eating Disorders at Penn State Children's Hospital. Dr. Ornstein, thanks for your time today.
Thanks for having me.
So this seems like it's a tough discussion to have. If an adult suspects an eating disorder with someone who they love, is that a tough discussion, a tough topic to broach?
It's definitely a tough topic to broach. There is a lot of denial in kids and adolescents and even adults who have eating disorders.
So what are what's some of the best advice you can give, first of all, to parents who might see some of the warning signs, which we'll talk about in just a moment, but what's some advice you have for parents?
I would say just like with any other thing that might concern the parent, they just need to sit down and have an open, honest conversation with their child, just like if they were concerned about their grades, possible drug use, or anything else. Ignoring it is not the way to go.
It's not something that's just going to pass if it's for real.
It is not just going to pass. These are not phases. These are not things that kids just dabble in. These are serious disorders.
And what about peers? If I'm a teenager and I suspect this in a friend, can they take action too?
Definitely. I often find that it's the peers who bring it either to the school's attention or the parents' attention. And I think as a friend, being a good friend is really important. If you feel that your friend is going to not be your friend anymore if you act for them, I understand that, but really the best thing to do for your friend is to try to take action and maybe get an adult involved.
You're watching Ask Us Anything About Eating Disorders from Penn State Children's Hospital. I'm Scott Gilbert alongside Dr. Rollyn Ornstein, and we welcome your questions over the course of this video, whether you're watching it live. We can pose those questions to her live, or even if you're watching it on playback after the fact, we'd be happy to share the questions with Dr. Ornstein and track down an answer for you that we'd share in the comment section as well. And if you like the content you're seeing right now, feel free to share it and help us get the word out about this important topic. We talked briefly about warning signs. What are some of the most common warning signs of, we'll speak in generally about eating disorders.
Certainly if one notices that their child is not coming to meals anymore, making excuses to not eat, such as I ate when I came home, I ate at someone else's house, disappearing after meals or just not coming down to the table, cutting their food up into small pieces, pushing food around on their plate. Those are some of the behavioral signs that might tip someone off that there may be an eating disorder going on.
As you mentioned those, though, I'm thinking, I can think of times that my kids have done that. It seems like every kid does that at some point, plays with their food, pokes it around. When does it cross that line? Maybe when you see a pattern?
Well, certainly, picky eating is common in much younger kids, certainly in toddlers. Picky eating really shouldn't extend significantly beyond into school age. If this is a new behavior, a change in behavior, I think is what I'm talking about.
Sure. And of course, back when we went to school, we took $1.25 or whatever in cash, and we paid. So it was, if a child wasn't going to eat lunch that day, they could hide that money from their parents. Today, it's a much more digital process in most schools. So that can be another warning sign, right? If you see it not being used.
Actually, that's true. I just had a patient come in whose parents said they noticed that she was not using her lunch account money. Now, a kid could use their lunch account and not eat the food, of course, but usually they won't do that. But by not buying food at lunchtime, that could be another warning sign.
Are there some other symptoms maybe not directly related to eating, such as, say, mood disorders, things like that?
A lot of kids who have eating disorders have other things like anxiety and mood disorders. Some of them started before the eating disorder, and some of them may be the result of the eating disorder.
Let's talk about some of the most common eating disorders. We've heard a lot about anorexia nervosa. What is that?
Anorexia nervosa is a disorder where the patient restricts the intake significantly such that they either lose a significant amount of weight, or if it's a younger person, they may not just make the weight gains that are appropriate developmentally. They often will have some over-exercising as well as part of that disorder, but the caloric intake is highly restrictive. And there's a lot of weight and shape concerns about becoming fat or overweight despite not being fat or overweight.
Compare that to bulimia nervosa.
Bulimia nervosa is characterized by binge eating, which is eating a large quantity of food in a relatively short period of time, usually in secret, associated with a lot of guilt and shame. And then there is a compensatory behavior, meaning something to get rid of the calories that were consumed. Most commonly, this could be self-induced vomiting. However, it can also consist of laxative use, diet pills and diuretics, excessive exercise, or severe restriction in between the binge episodes.
Sounds like there are, at the root of a lot of these are some body image questions that arise in someone's head. Can you talk about that and how they may have a distorted view of how they actually look?
Oh, absolutely. Both anorexia nervosa and bulimia nervosa have body image disturbance, weight and shape concerns at the core of the disorders for both of those, despite, not ever being overweight perhaps, or maybe being a little bit overweight. We are seeing increased eating disorders in kids who were formerly overweight as well, becoming anorexic.
And we hear a lot about the pressures, especially on women, to look good, to be as thin as possible. And to what extent do you think that kind of more public pressure weighs in?
I personally think that we have seen an increase in disordered eating because of the pressures on women and men, for that matter. However, patients who don't have as much access to media also develop eating disorders, so we know it's not really the only cause or the main culprit.
You're watching Ask Us Anything About Eating Disorders from Penn State Health. I'm Scott Gilbert. This is Dr. Rollyn Ornstein, and we do welcome your questions in the comment section, whether it's live or you're watching this video on playback. We'll definitely get some answers for you. And let's talk about a couple other types of eating disorders. There's one that has been recognized as an eating disorder. It's binge eating. Is that separate from bulimia nervosa, as you described it, which involves binge eating but then purging?
Yes, binge eating disorder is probably the most prevalent eating disorder, but it was only formally recognized in 2013 in one of the newer diagnostic manuals for eating disorders. It is comprised of similar binge eating behavior as I described for bulimia, but without any of the compensatory mechanisms that I described. And there was also less weight and shape concern associated with it.
I mentioned the pressures on women, but you also made the good point that this is not limited to teenage girls, which is who I think we often think of with eating disorders. Is that a common misperception, and how broad do you see patients coming from all demographics?
It's said that the ratio of females to males with the typical eating disorders is 10-1, so about 10% of patients are males. And I do believe that's what we see. However, I have definitely in my practice seen an increasing number of males, especially males who were formerly overweight.
In one of the comments that we got about on the Facebook post promoting this discussion, we had someone named Kelly who posted that she had struggled with an eating disorder, and she said, "I beat this illness, but I still have an awful perception about my weight." So how do you define a cure? Is there such thing as a cure from an eating disorder, or is it something that in many cases folks kind of learn to kind of cope with those feelings?
I do think that patients can be cured from eating disorders. Recovery is possible. I think some of the body image disturbance that goes along with the eating disorder may be somewhat normative. It's just how it really affects the patient day to day, how much of their, like a percentage of their daily hours are spent thinking about their body. I think that's one of the last things to improve would be the body image, even if the behaviors are under control.
We talked a little bit about the warning signs and the fact that anybody can take action and should take action if they see those warning signs. At what point is it time to call on a medical provider, and how do you determine whether it should be a primary care physician or even a specialist?
Certainly, if a child or adolescent has lost a significant amount of weight, it's important to go be seen, possibly by the primary care doctor first, if that's the relationship that one has. You can also go see a specialist if you're allowed without, getting a referral. If there is any concern on the parent's part, personally, even if they're told, don't worry, it's not a problem, I would say go seek help if you know as the parent that you are concerned about your child.
Have you heard of situations, I'm sure there must be, where a teenager says simply, "I'm not going"?
All the time. It's hard to get a kid into the office if they won't get into a car. I realize that, but again, be the parent. You're worried about your kid, you're the parent, you take them to the doctor. The hardest part is when I get a kid who comes into the office and they don't actually know why they're coming to see me.
I'm sure that happens.
That can be challenging, yes.
I imagine. And then they realize where they are, and but they're there for their own good, though.
Yes.
Again, we welcome your questions here at the bottom. And like I mentioned earlier, feel free to share this Facebook post on your page to help us get the word out about this discussion and this important dialogue around eating disorders. This is Ask Us Anything About Eating Disorders from Penn State Health. And the next question I have for you, Dr. Ornstein, is about the program here at Penn State Children's Hospital. There are both inpatient and outpatient components, correct?
We don't really have a true inpatient component. If a patient is medically unstable, we can admit them to the Children's Hospital for acute medical stabilization. If we feel they need a higher level of care, such as an inpatient eating disorder admission, then we don't have that component in our care. However, we do have what's called a partial hospitalization program or a day program, which is a Monday through Friday program. We have programs for patients 8 to 16 and another program for patients 17 and over.
When you say a partial hospitalization, that means they go home each night?
Yes, they either go home each night or they can also stay at the Ronald McDonald House if they live farther away.
What are the types of approaches you take as a specialist in working with someone in the first steps of trying to help them overcome an eating disorder?
Well, I certainly need to know whether they agree that they have a problem, sort of a motivational stage of change approach. If they don't even admit that there's a problem, then we have to first start getting them to admit that there's a problem. However, if they're unstable, then we need to take action whether or not they agree that there's a problem.
And if people want to get in touch with your program, obviously I'm sure they can do so through the Penn State Children's Hospital website, right?
Yes. There's also, they can certainly give a call to our nurse at 717-531-2099 to set up an appointment directly. They don't actually need a referral unless their insurance requires it.
Okay, we've got more information about eating disorders as well. In the one of the more recent Penn State Medical Minutes, you'll find that at pennstatehealthnews.org. And also, Dr. Ornstein was featured in a recent column in Central Penn Parent. It's actually the edition on newsstands right now, the March edition, so we encourage you to check that out. Dr. Ornstein, thanks so much for your time today on this important topic.
Thanks for having me.
And thank you very much for watching Ask Us Anything About Eating Disorders from Penn State Health.